A very good day. Today my team is going to present about the poultry industry assignment, that is diseases in the poultry farming. So the topic that we have taken is Pullorum disease. So the Pullorum disease historical name is bacillary white diarrhea. So it is caused by Salmonella enterica pullorum. Pullorum disease has caused a lot of economical loss and profit, which has been lessened due to this type of disease. And even until now, a lot of countries are being threatened by this type of disease. So this type of disease is affected the bird to huddle near the heat and are erratic, depressed, and may feel weak and have a white fecal material pasted to the vent area, and young chicks may feel very weak due to this type of disease affected to them. Even though surveillance tools have been used to identify this type of diseases, the potential of getting a false result is very high, and the chances of getting infected also between the flocks is also very high. So treatment that is being done is not easy. So identification and isolation should be done in the farm, and the type of birds which has been infected, which is the flock that is being infected, should be eradicated, because any other treatment is not sufficient enough to eradicate this type of Pullorum disease to the flock birds that has been infected. So in ensuring the development of the poultry farm, identification and isolation should be done, and the treatment that should be taken in action is to eradicate the flock of bird that is infected. And that's why it should be important to us. This type of Pullorum disease should be taken care by cleaning the farms in the poultry industry to making sure that Salmonella enterica pullorum disease has the high chances of the virus getting in an outbreak in the farm area. To ensure that the farm is being taken care properly and sanitized always, and to make sure it's always clean for the chickens for the upcoming generations to be bred and to be developed and to gain a lot of profits, and to ensure no loss of economical happen.
Now I'm going to talk about mode of transfer. There are many modes of transfer of Pullorum disease. Transmission can be vertical wire trans or various, which is a transmission from hens to chicks through the egg, or horizontally from infected birds, for example fecal materials, further dust, nasal and ocular secretions. It can also spread via contaminated feed, water or bedding, as well as through contaminated clothing, footwear, vehicle and equipment. Infection transmitted via egg or hatchery contaminations usually result in death during the first few days of life up to 2 to 3 weeks of age. Transmission between farms is due to poor biosecurity. Besides that, it also occurs mechanical spread by humans, wild birds, mammals, flies, and anthrax fixacs. Etiology of disease. Pullorum disease is an infection poultry disease caused by Salmonella enterica pullorum, which is a non-mortal bacteria highly adapted to chickens and turkeys. It is characterized by very high mortality, potentially approaching 100% in young chickens and turkeys within the first 2 to 3 weeks of age. The disease affects young chickens and also older chickens, but this disease is less severe in older birds compared with young birds. Diagnosis. Laboratory testing of blood and tissue samples for affected animals is necessary to confirm the diagnosis. Serology tests are satisfactory for establishing the presence and estimating the prevalence of infection within a flock to detect potentially positive birds. Serology testing alone is not considered adequate for positive diagnosis. Isolations, identifications, and serotyping is essential to confirm infections. Lesions may be highly suggestive, but diagnosis should be confirmed by isolations, identification, and serotyping of Salmonella enterica pullorum. Infection in mature birds can be identified by serology tests. followed by necrosis evaluation complemented by microbiology culture and tapping for confirmations. Postmortem disease. Gross lesions may be seen in chronic disease, but usually absent is peracute disease. When lesions occur, they consist of enlarged and congested liver, spleen, and kidneys. Yolk sacs can be restained with creamy or caseous yolk materials. White caseous nodules may be present in the lungs and heart. The pericardium might thicken with yellow or fibrinous exudate. Gastrointestinal tract might have white nodules on the gathered, ceca, large intestinal wall. Caseous corn can be seen in the ceca. Jaws are often swollen with yellow viscous fluid.
Signs and symptoms. In young birds, lesion usually includes unabsorbed yolk sac, focal necrosis of the liver and spleen, and grayish nodules in the lungs, heart, and gizzard. Firm cheesy material in the ceca and raised plaques in the mucosa of the lower intestine are sometimes seen. Occasionally, synovitis is prominent. Clinical signs in chicks and poults include anorexia, diarrhea, dehydration, weakness, and death. In mature birds, disease is less severe but decreased egg production, poor hatchability, and some increased mortality may occur. Adult bird carriers usually have pericarditis, peritonitis, and distorted ovarian follicles with coagulate contents. However, sometimes no gross lesions are seen. In mature chickens, acute infections produce lesions that are indistinguishable from those of fall typhoid. Prevention and treatment. Treatment of Pullorum disease is not feasible. Recovered birds have a tendency to become carrier of the bacteria. It is best to depopulate a flock that tests positive for Salmonella Pullorum. Control is based on routine serologic testing of breeding stock to assure freedom from infection. In addition, management and biosecurity measures should be taken to reduce the introduction of Centorica pullorum from feed, water, wild birds, rodents, insects, or people. Birds should be purchased from sources free of Centorica pullorum. The National Poultry Improvement Plan (NPIP) outlines the essential components for eradication of Centorica pullorum. To prevent pullorum disease, obtain your birds or hatchery eggs from a hatchery participating in the NPIP. Do not mix NPIP certified flocks with non-certified birds.
Now, I want to conclude a little bit about Pullorum disease. The Pullorum disease is a common disease of Salmonella pullorum fold. The condition is common and it is a significant disease for the poultry industry due to high morbidity and mortality, especially among young chicks between 2 and 3 weeks. Chickens are natural hosts and highly suited to these pathogenic agents. The disease can spread horizontally and vertically both by contamination. The practical method of diagnosis is the isolation of the body and serological testing. Antibacterial therapy tends to lower deaths. However, certain antimicrobial and handle chicken continue to be pathogen resistant. Therefore, it is neither viable nor beneficial to handle Salmonella pullorum. Effective monitoring programs, including stringent biosecurity control, routine serologic checks, and slaughter policies, can be accomplished by creating main management procedures. Lastly, the Pullorum disease leads to significant economic losses due to up to 100% mortality and management challenges. Based on the above conclusion, the following recommendation could be forwarded. Poultry and hatchery eggs from a licensed stock free of contamination should be bought. To avoid the spread of diseases, top management and rigorous biosecurity measures should be undertaken. Since an antibiotic sensitivity test is carried out, antibiotic treatment can be used. A successful serotype treatment vaccine should be developed. The premise and Mechanical carriers should be cleaned and disinfected regularly. Finally, farmers should be advised and educated on the use of salmonella-free parents.